Now we'll discuss the subcuticular suture, one of the most important and commonly used suturing techniques. The subcuticular suture involves taking bites through the dermis, closing the tissue like a zipper, keeping the knot completely buried, and leaving no track marks on the skin. It's one of our most effective and most commonly used suturing techniques. So let's get started. We have an open wound here, and since we'll be suturing through the dermis, there should not be excessive tension beneath the dermis. If there's too much tension, we first relieve it with vertical or horizontal mattress sutures. We don't have much tension here, so we can close it directly with a subcuticular suture. Again, we start at the very beginning of the wound, just as if we were placing a vertical dermal mattress suture. First, we go from deep to superficial. Then, on the opposite side, we go superficial to deep for our first bite. After securing the knot, we trim it as short as possible, so it stays buried and doesn't get in the way when we start the superficial sutures. Now we take our first bite through the superficial dermis near the epidermis. In a controlled manner, using equal bites and even spacing, we continue the suture. We enter on the opposite side and pass horizontally through the dermis. As you can see, the wound begins to close. Now, in the same way, we continue placing the suture from the opposite side, parallel to the skin, just as with a horizontal mattress suture. We make sure to enter almost directly opposite where we exited. I'd like to emphasize this once again. We enter through the dermis, close to the epidermis, to avoid damaging the epidermis. This also allows the sutures to support the skin. We complete the parallel pass. We move forward slowly. Some of you may have noticed that I use toothed forceps to grasp the dermis directly instead of holding the skin itself. We're just about to complete our horizontal pass. Yes. We're now reaching the end of the wound. The wound edges are coming together nicely. Now we finish the suture. We've reached the knotting stage. We made one final pass. And we finish by tying the final knot. Once again, we take a slightly deeper bite this time, leave a free loop, and use that loop to securely tie our first knot. Then, we don't want the knot to be visible, so we pull from both sides to seat it securely. Now, the important thing here is to cut the short end as close to the knot as possible. To bury the knot within the tissue, we make one final pass with the long end. Passing it through once more to push the knot down. We complete the suture. And with that, the subcuticular suture is complete. Now we'll be talking about a suturing technique we use much less often, the half-buried subcuticular suture. Here, we keep the knot buried on the thicker side, while exiting through the skin on the thinner side, where scarring is less important, allowing us to achieve good eversion.